Okay, this is an overview of a activity that addresses social justice, specifically social justice around access to healthcare. So, the film is called The Waiting Room, and it is a documentary that is a cinema verite style documentary, meaning that there is no narration. Um, the I think main point of this documentary is to show what goes on in an average day within a safety net hospital. Now, why did they title it the waiting room since it's an emergency department? Well, many of those depicted in the film have been waiting 8 to 12 plus hours, and they are there for routine health care. Now, this emergency department certainly does deal with emergencies. There is one rather disturbing segment of a young man who dies of a gunshot wound. So the policy issue that this addresses is health insurance coverage. And proportionally in the United States in the last 7 to 8 years, the percentage of Americans with health insurance coverage has risen. Um, much of this due to the Affordable Care Act. However, there are still roughly 11% of Americans that don't have health insurance. And then there's a high percentage of Americans who are what would be called underinsured, meaning they have very, very high deductibles, like 2,000, 4,000, or their insurance doesn't cover um, certain aspects of healthcare, like uh, certain medications. So those people are considered to be underinsured. And you'll notice that almost a third of those with employer-based health insurance coverage, which is the most common type in the US, but almost 30% of those are considered underinsured. And you can see that close to half of Americans have skipped or delayed care because of the cost. So, how did the hospital emergency department become a clinic essentially for those who are un or underinsured? Well, some years ago, the federal government passed the Emergency Treatment and Labor Act, Emergency Medical Treatment and Labor Act. Um, the background for this was a gentleman who had been badly burned on the job and drove himself to multiple emergency rooms and was turned away. Um, the Emergency Medical Treatment and Labor Act requires that all patients who appear at an emergency department must have access to medical care in that setting, even if they cannot pay for it. And the law basically says that patients must be evaluated and treated. Oftentimes that you'll see in the film that occurs in the emergency department itself. Occasionally patients can be transferred to another facility, and occasionally they're admitted to the hospital. The key thing here is care must be provided regardless of whether or not the patient can pay. And the emergency department has become the site for health care for persons who are or underinsured. So let's talk a little bit about using this for teaching. In an introductory level class, I introduce Bronfenbrenner's systems model, which you see there with concentric circles. In my university, lifespan development is an introductory psychology class and also meets general education requirements for a psychology class. So in our discussion, when we get to Bronfenbrenner's theory, I first point out that it is rather different than that of Piaget, Freud, Skinner, in that the focus is on larger systems that impact individual development. The upper level class that I have used this for is health psychology. It's a 300 level class at my university. And in that course, I introduced a different systems model, that of Engel, who's an internist, who developed the biopsychosocial model, where you go from cellular to global. And this model has been used in medical schools, but it also appears in many undergraduate psychology textbooks. And I introduced the model very early on in the course, and we worked through some cases of patients from the perspective of these different levels. Also, it's not unusual in the health psychology class to talk about how the U.S. healthcare system works. Programs like Medicare, Medicaid, what it means to be in an HMO, those kinds of things. So the waiting room can prompt discussion of those issues as well. So for introductory students, I basically, first of all, I tell them a little bit that this is a safety net hospital, and that people are there to get care. Many of them are there with problems that could probably be handled in an outpatient clinic setting. So my first query is basically to show them a clip of the film and basically ask, first of all, do they understand what's going on? Do they understand why these patients with hypertension who need their medication refilled are seeking care in the emergency department? And one of the things I do is I actually do the circles and ask students to map these healthcare issues onto Bronfenbrenner's model. And while we certainly can begin with a given patient for the issues that are seen in the waiting room, for the issues that appear in the waiting room as a film, these are larger scale health policy issues. But again, the focus here on an introductory class is basically, do these larger forces impact psychosocial development? And one very timely one that I put down at the bottom of the page here is, this is a current issue that African American women who undergo childbirth are 2 to 3 times as likely to die during childbirth as white women. So for the advanced class, again, students have been exposed to the biopsychosocial model. I use that instead of Grafenbrenner in advanced classes. And again, I usually begin by showing some of the film and asking students if they were aware of the issue. And also, my university sits right on the border with Canada. We periodically have Canadian students in the class, and I ask if something like this would happen in Canada, France, or other countries with universal coverage. Students generally are aware that the emergency department is for acute emergencies, and that many of the patients seen in this particular film certainly need health care, but certainly don't need to be in an emergency room. Um, there is a section towards the end of the film that I really enjoy showing, because I think it really gets the point across to students about what's happening in this particular emergency department. Young man is wheeled in having sustained a gunshot wound, and you see that the healthcare team working on this guy, trying to revive it, giving all of their efforts. And then right after that, there is a scene of a woman, probably in her 60s, who apparently has diabetes, and has been spending the day there waiting, and asks the charge nurse if she could have a sandwich. Um, I think that is a very interesting juxtaposition of what emergency departments are, quote, supposed to do, and because of our healthcare system, what they end up doing as safety nets. Now, back to the issue of social justice, and this is probably something I would only deal with an upper level class. In particular, I do deal with this issue in some of my capstone class for psychology majors. Um, Basically, to solve problems like this, we've got to get out of the psychology silo to some extent, and policy changes would be necessary. Students are usually pretty supportive in the idea of some type of universal coverage. Um, I do point out that our professional association does encourage psychologists to advocate policy change. And I ask them what mechanisms that they would use um, to affect policy change around healthcare. This might include who they vote for in the next election. Um, it might be sending thoughtful letters or emails to their congressional representative. And then there are professional organizations, including APA, that actually lobby in Washington. Here's the issue. Is this an appropriate role for psychologists? Certainly, we are getting at issues well beyond individual personality, emotion, and cognition. And is this something psychologists should be doing? Under what circumstances should they or should they not? And on that note, I will leave you. Thank you.